how bad could a steroid shot be? I mean, shouldn't we just basically give one to everyone who walks into an urgent care clinic complaining of any sort of pain or inflammation? Isn't that just the easiest solution? No. A person recently called me and told me how horrific a steroid shot, specifically Kenalog, is and has been for her. How it has basically destroyed her life. And how, in my opinion, urgent care clinics have no right to ever dispense a steroid shot. That's pretty controversial, right? So hear me out. Let me tell you the story, and then tell me in the comments whether you agree with my diagnosis that urgent care clinics have no business in steroid shots. All right. So this young woman called me and she said, "Hi, my mom has had to take care of me for the past 12 weeks. Am I ever going to feel like myself again?" I was like, "What? What's going on?" And here's what she said. She said, 12 weeks ago, I went to an urgent care clinic. I was having lots of symptoms, didn't know what was going on, and I felt awful. And I was so sick that when they said, "Oh, here, I'll give you this," I didn't do my normal due diligence of like looking it up online, finding out exactly what the side effects are. I was just like, "Yeah, I feel awful. Sure, give it to me." Apparently, she was having flu symptoms or maybe allergies. And this urgent care clinic provider, I'm not sure if it was a actual medical doctor, physician's assistant, nurse practitioner, or some other mid-level practitioner. I have no idea, and she doesn't either. She said, "Does it have any side effects?" And she said, "No, I get them monthly." As if like the provider itself is getting these steroid shots every month, like a B12 shot. Like you can just get these B12 shots every month and it's no problem. Like literally that's a thing people do and that's fine. Usually B12 shots have no side effects. And if that's what she was referring to, then why'd she give her Kenalog? No, nobody gets Kenalog shots every month. You can check out my video I made just last week all about cortisone shots versus prednisone pills and how often you're allowed to get them. And getting them every month is just not a thing that most doctors are willing to do because of what I'm about to tell you. So immediately after getting the shot, she instantly, within a few hours, had severe, intense flushing, just bright red, hot, miserable feeling. Like she's a young 20-something, and now she's feeling like she's like stereotypical going through menopause woman. Not really happening, right? She's not going through menopause. She's just having severe flushing. Then she felt like she was going into psychosis. What it was doing to her brain was unreal. She was a normally mentally healthy person, although she did have lots of other health conditions, but normally they didn't affect her mental health, right? Like she maybe has a history of Ehlers-Danlos syndrome, mast cell, other things, POTS, which is postural orthostatic tachycardia syndrome. And so she had other health conditions, but they didn't usually affect her mental health. So I'm attributing all mental complications to the drug because that's totally reasonable. If you check out the video I made before I talked to her, I actually predicted this situation exactly. When you're using steroids of any kind, you are making a deal with the devil, and you do not want to make that deal when it's not completely in your favor. Like it's got to be so awful in order to want an injection like this, in my opinion. Thing is, like you can go off a prednisone pill of 5 milligrams really fast. If you're having these psychotic hallucinations and it's stuck in your body for 3 months, holy cow, that's going to destroy your life. In addition to the psychosis, she had extreme anxiety, depression, and dizziness. Her muscles felt so severely weak. She has barely been able to get off the couch for 12 weeks. Her blood pressure and heart rate have been completely out of control, sometimes tripling in intensity and speed, making walking outside in the heat feel completely impossible. And then worst of all, she feels terrified all the time. Just this hyper vigilant feeling completely disconnected from herself. Like she's a passenger in a car that she's never driven before. And that's apparently her body. She said she can't be alone. She's so scared. what it's done to her brain. She feels like being alone would be so terrifying. And so even though she's an adult who normally lives on her own, her mother's had to come and live with her for 12 weeks. So this isn't just about physical things, a Kenalog shot. She told me that the mental struggles are by far the worst part. They're the worst thing she's ever been through. And that's really saying something because she had brain surgery last year and didn't have mental complications then. So she went back to the clinic and said, hey, I feel horrible. I can't move. I can't be alone. This has destroyed my life. What should we do? And they said, oh, the Kenalog is totally out of your system. That can't be it. It's actually, at this point, you're having a psychotic reaction, or it's probably just a mental thing. It's not the drug itself. And she's like, no, it's not. And they totally gaslit her, didn't believe her. So she contacted them again and said, hey, this is horrible. What are you going to do? And they said, oh, well, that provider is no longer with us. She's like, what? Why? Where'd she go? They wouldn't tell her where she went, and they wouldn't tell her why, but, maybe this kind of situation would lead to that kind of termination. I don't know. So when a doctor says the steroid's completely out of your system, let's talk about Kenalog, and then when it's really out of your system, and does that even matter when it comes to the side effects? Okay, so Kenalog, if it's injected, like the long-acting version into the gluteus maximus, which is pretty sure where she got it, that is a 3-month, 12-week injection. She called me at week 12. So there's no way it's out of her system if it was actually Kenalog. Unless somebody's miscommunicating, it's still in her system, okay? First. Second, even if, let's just compare this to like a wildfire or a tornado. Well, look, it's not smoking anymore. The wildfire's completely gone. Why are you still complaining about the damage? Okay, so my house is gone. My car is just a piece of, all I can see of my car are some hubcaps. And you're telling me that I should stop complaining about my wildfire damage? No. Just because the wildfire's gone, or just because the tornado has finished destroying the whole town, doesn't mean the damage isn't still there. Doesn't mean it didn't do really bad things. Just so the wildfire's gone. Yep, the smoke has stopped smoking. But there's still a pile of ash that has not been rebuilt into a house, right? Her brain is that pile of ash that has been plowed through, destroyed the balance. The balance is gone. Her physical balance, her strength, her blood pressure, and her mental health have all been dramatically affected by this reckless choice of a provider to inject a long-acting steroid for the flu or allergies. We're not even sure what the actual diagnosis was that was inciting this event. And let's go back to that actual diagnosis. And if you want to see more about my passion on this project, I have another video all about how there's literally no reason a steroid of any kind, let alone an injectable that lasts 12 weeks, should be prescribed by any doctor for anything a child could bring home from school. I'm talking about the flu. If your child brings the flu home and hands it to you, you should not be getting steroids for it. Strep throat, ear infections, sinus infections, bronchitis, pneumonia. There's no evidence that steroids of any kind are going to help any of those contagious diseases. And if she just has allergies, why not just give her some Zyrtec? Why would you give her 12 weeks of steroid in her rear end? That doesn't even make sense. None. Makes no sense. Does her allergies really last 12 weeks, or is it just 4 weeks when one bad pollen is in bloom? Okay. So diagnosis was spotty, and then it was inappropriate, even if it was one of those actual diagnoses. There's no reason anyone should be getting prednisone, Medrol dose pack, Kenalog injections, anything in any urgent care clinic for any of those diseases, ever. It's not appropriate. There's no clinical evidence that it is effective or, in the light of this, safe, in balance. The only situation of any of those infectious diseases that it might be appropriate is when a person is hospitalized with severe pneumonia. Like they've been intubated and they're not breathing on their own and they have pneumonia. That is the only time when any infectious disease qualifies for a steroid. Okay? Like never. It's not appropriate. Don't do it. Stop prescribing steroids. Stop steroids for seasonal sicknesses. It's not appropriate. Okay? So, what should she have done? She was sick. She was vulnerable. She was in a situation where she could poorly advocate for herself, right? I've been in that situation. I've been so sick. My doctor, who becomes my friend, is like, what drug do you want? What dose? Because she knows I'm a pharmacist. I'm like, I can't think. Like when you have sickness, when you have a fever, those things go to your brain and make it hard to think. Like little reactants go to your brain. These inflammatory mediators make it actually hard to think. And so it's not her fault. It is not her fault. But if you are in the situation where you do have the ability to be on top of it with your brain, your mental function, when you're in a doctor's office, be sure to always ask, are there any other alternatives? What are the side effects? Would you give this to your daughter or your son or your grandma, whatever you'd be in relation to that person? Because if there are any other alternatives to steroids, use those. These should be a last resort for somebody who's dying of pneumonia in the hospital, not your, hey, just throw it out like candy. It's just a Medrol dose pack. It's really easy. Nobody has to do any work. We just give them the pills and then they're fine. No, they're not fine. Nobody's fine. These steroids are scary. They cause horrible side effects. And this young lady is not the only one who has called me with such a horrific story of the consequences of this type of prescribing. So don't let any family members or anyone else take a steroid unless it is evidence-based and the benefits truly 100% outweigh the risks. Like if you're ever concerned, get a second opinion. This stuff is not candy. This stuff isn't mimicking your body's naturally occurring hormone called cortisol that is truly a miracle and saves us from disasters, but it should not be saving us from blisters. Blisters aren't worth it. Little cough, not worth it. Severe pneumonia? Yeah, that's worth it. Somebody's dying? Great, give it to them. One hospital person said, no one should die without steroids. Great, fine. You've got nothing else to try? Go for it. In that case, they're not going to notice the psychosis because they're probably unconscious, right? If this is a last-ditch effort, okay. You've tried everything else? Great. But if without those justifications, please only use prednisone, Kenalog, and other steroids when you're certain the benefits outweigh the risks. And if you absolutely have to use a steroid injection or prednisone, then you need to know exactly my best tips for how to deal with those side effects that you're likely to experience, because 70% of people do. And that's called my Prednisone Checklist. Check out my Prednisone Checklist. It's got the tips of what you can do to minimize the side effects, to keep the balance of the benefits of the risks in your favor. And it's evidence-based. I go through and cite actual scientific articles in all my tips. They're all based on actual science and not just, hey, everyone should get this shot every month. It makes you feel so good. No one should get that shot every month. And if you want to learn more about that shot, check out my video that I made with comparing prednisone to cortisone shots, because there's places where one is more appropriate than the other. And you need to know that before you can kind of make this kind of a decision. All right, signing off as Dr. Megan, your prednisone pharmacist.